Hello, and welcome to the 48th Annual AAKP National Patient Meeting, Transforming American Kidney Health, Patients Take the Lead. My name is Melissa Bensouda, and I'm a home hemodialysis patient from Texas. I've been able to dialyze at home for 12 years and experience the convenience and freedom provided from home therapy. I also have the honor of serving as an AAKP Ambassador. Being an ambassador has allowed me to meet and connect with legislators, healthcare professionals, scientists, in sharing my experiences in hopes that others have improved care. As a member of AAKP, I share the message that every kidney patient has the most important voice in determining their care plan. It is imperative that an environment is created that supports kidney disease research and innovations so that we are continually advancing care and providing solutions for unmet patient needs. And when those innovations are FDA approved, it's crucial that all patients have access and the right to choose the treatment that is best for them in consultation with their doctor that they choose to care for them, so every patient can live their best life and achieve their aspirations. And with that, I am pleased to introduce our next session titled Advancing Dialysis for Improved Patient Outcomes. You will undoubtedly be impressed by the speakers we have lined up for this session. Allow me to introduce our first speaker, Dr. Cynthia Silva. Dr. Silva is an innovative physician leader who possesses extensive experiences in developing patient-centered solutions and a strong dedication to enhancing accessibility to medical technology advancements in the field of dialysis and promoting health equity. Dr. Silva, thank you so much for being with us today. I'm really excited to speak with you about the Tablo machine. Outset Medical has really reimagined dialysis and created an innovative machine that truly has the patient in mind and that increases patient care choice, a principle that AAKP fights hard for every day. What are some of the main features of Tablo and how do they affect patient care?
We all know that the traditional dialysis treatment can dominate a patient's life. Treatments can average between 3 and 4 hours, not including travel time to and from the clinic. And many dialysis patients drive to these clinics several days a week. Dialysis is also really tough. For patients, it strips them of their energy and the time to do the things they love. For the hospitals and the clinics, it's very costly and it consumes much of their staffing resources. The dialysis market really hasn't changed in 30 years, whether in the way it delivers care to patients or its equipment, and it's long overdue for disruption. And that disruption is now underway. The missing link is the Tablo hemodialysis system, an easy, patient-friendly device that changes the dynamic of who can be successful at home and how to oversee a home dialysis program. Tablo is an all-in-one dialysis machine that combines consumer product simplicity, wireless connectivity, and on-demand integrated water purification in a compact, small 35-inch unit. It takes about 20 minutes to set up with no batching of bags or need to use other supplies. This really reduces the overall supply by almost 2/3 compared to other devices. A connected, intelligent device, Tablo has two-way communication with the cloud, enabling efficient documentation and system management for providers and their teams. Tablo's intuitive touchscreen guidance makes it easy to learn and use. Patients have referred to it as the iPhone of dialysis, really thoughtfully designed and can reduce training times into a few hours. Tablo needs just tap water, an electrical outlet, and a drain to operate. It eliminates the need for costly and space-consuming water treatment-related rooms, equipment, and supplies. Tablo overall has the flexibility to deliver dialysis up to 24 hours, addressing the needs of nephrologists and nurses and their patients in the hospital and the home setting. I would like you to watch this next video to really see more about it.
Tablo is bringing renal replacement therapy into the 21st century. Finally, a modern dialysis system that optimizes care delivery across settings with smart, connected technology. Tablo was designed from the inside out to improve the dialysis experience for patients and reduce the cost of care for providers. Inside its compact 19-inch wide frame exists an integrated water purification system, so Tablo can produce dialysate on demand, custom to each patient's prescription. Nurses can be fully trained and have Tablo up and running within hours. And patients can learn Tablo for home use in just 2 weeks. That's how easy Tablo is to learn and use. And with advanced features like automated documentation and real-time remote monitoring, Tablo was designed to ensure quality, save time, and streamline record keeping from the hospital to the home. For the first time, a single system can deliver dialysis anywhere, anytime, by virtually anyone. That's Tablo, an enterprise solution for renal replacement therapy. Learn more at outsetmedical.com.
That's very exciting. Can you share how the Tablo machine changes the patient experience of home dialysis?
So Tablo is a device that can be used on dialysis patients in all care settings. This familiarity is really extremely helpful in how patients do on dialysis. So when you meet the device, when maybe you crash onto dialysis, you weren't expecting it, it's in the ICU or in the hospital with you, being able to then learn it and use it in the home setting makes you that much more successful. I think home dialysis really is the next big trend in home healthcare. So many other sectors of medicine are delivering care to patients in their home in many different ways. Why should dialysis patients be left out of this? Currently, there's more than 500,000 chronic dialysis patients in the United States. And many nephrologists and other experts believe that 30% of these patients are eligible for home hemodialysis. Yet currently, only 2% of patients receive dialysis at home. Not only does home dialysis help safeguard patients who are at risk for infections, but during the pandemic, this became even more important, allowing social distancing and really protecting patients. It also can help enable individualized treatment plans and overall give patients essentially precision medicine. And these dialysis patients have not really had the opportunity to experience this, as it's been a one-size-fits-all in a center model. Equally important, it can restore precious independence, dignity, and time to patients who have been forced to adhere to the clinic's schedule and their processes. Outset's goal was to create and deliver a dialysis machine that was accessible to patients and remove the major barriers to home dialysis. We continue to work towards this goal every day.
Thank you, Dr. Silva. This is all really fantastic. The research and development Outset Medical has done to develop Tablo and what the company continues to do to innovate is truly inspiring. As a home dialysis patient myself, I fully support devices that are designed to empower dialysis patients and give them back control of when, where, and how they dialyze. Before I let you go, I'd be remiss if I did not highlight that September is National Emergency Preparedness Month. During our event on day one, we heard updates on the continued impact of COVID, and just this morning, AAKP's Ed Dickey and Paul Conway jointly led an important session on emergency preparedness strategies for both natural and unnatural events. Based on their expertise managing national disaster response efforts. I think it's interesting to share with our audience that the Tablo machine is the only dialysis machine that's currently in the Federal Reserve for emergency situations. and is the first single dialysis device platform that can be used anywhere from the hospital to the home. I'd like to share that Tableau's FDA clearance for hospital use enabled Outset to provide critical dialysis support during COVID. But with national disasters or humanitarian crises, there's an increased risk for water shortages and or poor water quality due to severe infrastructure damage. Can you share how this machine helps address dialysis issues in these types of situations?
I think Tableau has proven to be the best all around solution for emergency situation due to ease of training, setup and use, and versatility in terms of all different treatments it provides, especially at a time when it's critical for a patient's survival. Proof of this is a recent study conducted by the FDA on Tableau, the largest ever on a home hemodialysis system, that patients actually make less mistakes because of how Tableau was designed. In this research, patients and their care partners completed a 3-hour training and then were asked to perform tasks on setup and using the device, and then their errors were recorded. They had less than 1% errors while doing this. When you compare this to other devices, this is less than a quarter of the errors that people made on other home hemodialysis systems. So suffice it to say, this allows increased access to dialysis with a machine that goes in the home, while mistakes are lower, even when the pressure is higher because you're stressed in these emergency situations. Now, the device itself is specifically designed to address problems exacerbated during disasters. The device is an RO-based system which has been shown to provide better water and dialysis to patients. This, combined with over 100 sensors inside the machine, can let the patient know when to change the filters and ensure the quality of dialysis is unchanged despite a humanitarian crisis. Disease from infections is common during these crises. Tableau has a quick disinfection mode to address this and protect these patients who are already at higher risk of infection due to their kidney failure. These are just some of the main features which, as a nephrologist, give me reassurance about my patients in an unpredictable emergency situation.
Thank you, Dr. Silva. Outset Medical is certainly filling a critical need for some of the most vulnerable populations. And finally, what is Outset's vision for advancing home dialysis?
Our vision is that we start now. Our vision is not forward-looking. It starts today to ensure patients get quality home care. We're grossly underprescribing home hemodialysis to patients. We have this now, and we need your help to reach patients with the technology. Our mission is to provide services and technology that is optimized to make the patient successful at home. Breaking out of the existing status quo in-center model so that more doctors and hospitals can offer these options to patients is what will advance home dialysis. Fueling expansion of newer providers offering home dialysis, whether that's in a metropolitan setting, an urban, or even a rural setting. Some of this is already underway with our expansion into the Hawaiian Islands and Alaska. This work starts now, but we need help like organizations like yours to increase awareness and get this technology to patients. But, I would say that this is my perspective from a nephrologist point of view. I think seeing the patient's perspective is equally, if not more powerful. And this next video, I think, captures it perfectly.
The Tableau not only gives you the words step by step, it gives you pictures. Everything is automated. You don't have to think too much. It tells you exactly what you need to do. You can't mess up. If you mess up, that means that you're not reading properly and you're not looking at the screen and taking time. It's how easy it is to use. That's the key thing, because a lot of people would say that, this is dialysis is very serious and you gotta, make sure you know what you're doing. But if you're trained properly, you could do this.
Well, training for me, I wasn't expecting it to be so like intense at first, or like wow, this is like life or death when like alarms go off. I feel like it was easy though because it's so laid out for you visually and word wise. My mom can trust in me now that I can help her while I'm at home.
It was 2-week training. John, the dialysis nurse, he was there, and he went step by step. They're very patient. Like if I wasn't ready in 2 weeks, I would have stayed a little bit longer, but I got it. So I felt comfortable enough to bring her home and to start doing dialysis at home.
Thank you, Dr. Silva. It's been such a pleasure learning from you. And as a dialysis patient, thank you for providing us with the confidence that there are companies out there that see beyond facility walls and strive to support the aspirations of kidney patients to take ownership of their care and their confidence to dialyze at home, as well as having our backs in the event of emergency so that we do not become a post-storm statistic. At this time, I would like to move to our next speaker, Dr. Mariana Murea. AAKP has had the privilege of collaborating with Dr. Murea on several occasions, and we eagerly anticipate further fruitful partnerships. In the way of introductions, Dr. Murea is an associate professor of nephrology at Wake Forest University School of Medicine, and she serves as a principal investigator for the TwoPlus trial, a patient-centered outcomes research institute funded research project. Dr. Murea and her co-investigator are dedicated to enhancing the quality of life for individuals undergoing dialysis. Their ultimate goal is to not only improve their overall health, but also facilitate a smoother transition toward kidney transplantation by researching conventional dialysis versus incremental dialysis treatments. It is my pleasure to turn the presentation over to Dr. Murea.
Thank you, Melissa, and thank you, AAKP, for having me at the 48th National Patient Meeting. I'm going to talk today about the TwoPlus trial, which is a comparative effectiveness of an individualized model of incremental hemodialysis versus conventional hemodialysis. The TwoPlus study is a clinical trial funded by the Patient-Centered Outcomes for Research Institute, PCORI, and the study teams will apply two different approaches to hemodialysis initiation in persons who have residual kidney function when they begin treatment with chronic hemodialysis. The approaches to hemodialysis initiation consist of incremental start hemodialysis versus conventional hemodialysis. And the key objectives of this study are to compare patient safety outcomes, to compare patient-reported outcomes and caregiver-reported outcomes, but also to delineate the advantages and the disadvantages of incremental hemodialysis from the point of view of different stakeholders. So first, I'm going to define some of the key features of the TwoPlus study. What is residual kidney function? Well, residual kidney function is the level of kidney function that is present in individuals who require addition of dialysis for the treatment of their severe kidney dysfunction. And it has been noted that individuals who start dialysis manifest different levels of residual kidney function that range anywhere from good residual kidney function to moderate residual kidney function, or even very low or absent residual kidney function. And it is expected that after hemodialysis is started, the residual kidney function is going to continue to decline just as it declined before dialysis was started. So the question the TwoPlus research team has, should we adjust the dose of hemodialysis by taking into consideration the level of residual kidney function each patient has at given time points of dialysis initiation and during their journey? And is it safe to do so? Conventional hemodialysis is often simply referred to as hemodialysis. It is a medical procedure used to treat individuals with end-stage kidney disease or kidney dysfunction requiring dialysis. It is a highly effective treatment for end-stage kidney disease, and it typically consists of 3 hemodialysis treatments per week, usually administered at outpatient dialysis centers. And conventional hemodialysis targets a certain level of clearance of toxins from blood over 1 week period. And we call that dose, the targeted dose per week, standard KD/V. This approach to hemodialysis has been tested and proven to be effective in patients who have end-stage kidney disease and low or absent levels of residual kidney function. On the other hand, incremental hemodialysis is an approach to dialysis that involves tailoring the frequency and duration of dialysis sessions in the individuals who have residual kidney function at dialysis initiation, who have either good or moderate levels of residual kidney function. And then after dialysis is started, then the hemodialysis dose and frequency is tailored by changes in residual kidney function and clinical manifestations. Importantly, patients on incremental hemodialysis are closely monitored by their healthcare team to assess their progress and adjust the hemodialysis treatment plan as necessary or according to the overall health of the patient. So why do we want to study incremental hemodialysis? Well, the short answer is because it allows for a more patient-centered approach. We theorize that not all individuals require the same intensity of hemodialysis treatments, and we want to identify effective means of dialysis care in the form of kidney assistance therapy rather than kidney replacement therapy, as conventional hemodialysis is currently considered. Incremental hemodialysis seeks to offer individualized hemodialysis treatment plans that minimize potential drawbacks of insufficient dialysis, such as fluid overload and toxins accumulation, while it also balances the burden of full dose hemodialysis from the beginning of dialysis treatment. But it's extremely important to notice that incremental hemodialysis is not suitable for all individuals who start chronic dialysis. And the safety of incremental hemodialysis needs to be validated in clinical trials, which is what we aim to do in the TwoPlus trial. And I'm very fortunate to lead this study alongside Dr. Peter Kortanko from the Renal Research Institute, along many other investigators. Enrollment will take place at 10 healthcare systems affiliated with 4 dialysis organizations, spanning more than 50 dialysis units across the nation. We're currently in stage 1 of the study, which consists of active preparations of local healthcare team for study implementation at all these participating healthcare systems and dialysis centers. And recruitment is planned to start the first quarter of the year 2024. The TwoPlus study is a hybrid effectiveness implementation randomized clinical trial. We, as I indicated, we will include patients who have new onset chronic hemodialysis and also have adequate levels of residual kidney function that we define as kidney urea clearance equal or more than 3.5 milliliters per minute per body surface area, and a urine output of at least 500 milliliters per day. And we target enrollment of 350 patients in total who will be randomized to incremental hemodialysis that consists of twice weekly hemodialysis of minimum 4 hours per treatment, plus adjuvant pharmacotherapy, meaning that all patients will be recommended a loop diuretic and sodium bicarbonate and a potassium binder, patiromer potassium binder when needed. Or the patients might be randomized to receive conventional hemodialysis, which consists of thrice weekly hemodialysis, as is usually prescribed by their treating providers. During the follow-up, the study teams and the treating providers will monitor residual kidney function on a quarterly basis. And the hemodialysis prescription in the incremental dialysis group will progress from twice weekly to 3 times weekly according to changes in residual kidney function or clinical or other medical needs. We also plan to enroll a total of 140 caregivers, and the caregivers will have equal distribution among the two patient groups, meaning there will be 70 caregivers that are associated with the patients who are part of the incremental start hemodialysis, and 70 caregivers who are associated with patients who are randomized to conventional hemodialysis. Patients randomized to incremental hemodialysis will be asked to continue to take their diuretics and their sodium bicarbonate that they were more often than not. They were already on these medications prior to dialysis initiation. And as needed, they will also be asked to take a patiromer potassium binder based on their serum potassium levels. Dialysis treatment for the patients who will be in the incremental start group will be of 4 hours per treatment at the beginning, and then any changes in dialysis prescription afterwards, either in the incremental group or conventional group, will be guided by the study teams, local study teams, and the treating providers. We assemble criteria for progression from twice weekly hemodialysis to 3 times a week hemodialysis. This criteria will guide the investigators and the treating providers in clinical decision making as to when it becomes necessary to intensify the dialysis treatments when those who initiated or who were randomized in the incremental start group. And these guiding criteria are categorized into residual kidney function criteria. For example, when the residual kidney function gets into the stage of low or absent or less than a moderate level, such as a kidney urea clearance of less than 2.5 milliliters per minute per body surface area, or urine output is less than 500 mLs per day, that is usually when the dialysis needs to be intensified to offer sufficient clearance of toxins and sufficient volume clearance. There are also other solid clearance criteria and volume management criteria that are very important and that will be monitored during the study. And it is important, though, to note that this decision to transition from twice weekly to thrice weekly hemodialysis will not be based necessarily solely on one criterion. It could be several criteria that are listed on this slide. And that decision can be made either by the treating providers or by the research team. The primary outcome of this study is that of safety, which in essence is a very robust outcome of clinical effectiveness. And it will be assessed, the safety will be assessed as a composite of all-cause ED visits, hospitalizations, or death. A number of other outcomes will be analyzed, including patient-reported outcomes, changes in residual kidney function, caregiver-reported outcomes, employment status, functional status, cognitive function, volume management, electrolyte and acid-base homeostasis and mineral metabolism, anemia management, vascular access outcomes. All these different outcomes will be compared between the two different approaches to hemodialysis initiation, meaning incremental start versus conventional hemodialysis, to get a comprehensive picture of patient outcomes and their quality of life as to whether those differ between these two different approaches. We have partnered with patient representatives, dialysis nurses, dialysis dietitians, and dialysis social workers, and stakeholder advisory panels from across all participating healthcare systems will be formed on an ongoing basis. And we will use or conduct semi-structured interviews with the members of the advisory panels to garner the points of view of all stakeholders regarding perceived advantages or disadvantages of incremental hemodialysis and perceived barriers and facilitators associated with the implementation of incremental hemodialysis at each healthcare system. To conclude, I want to highlight key principles and goals of the TwoPlus trial. Implementation of the intervention in this study, which is incremental start hemodialysis, will be undertaken in a collaborative, coordinated, and accessible manner. Collaboration will be ongoing between the study teams, enrolled patients and their care partners, and the treating providers. We are educating healthcare providers and dialysis staff at all the participating healthcare systems and dialysis units to ensure a coordinated approach. And we strove to include different dialysis organizations in order to afford the accessibility for this study for all the patients who are started on hemodialysis. We focus on accountability from all parties, meaning that patients and their families are expected to be part of the care in this study and play a crucial role in the research team's ability to delineate the safety of incremental hemodialysis. Adherence to serial measurements of residual kidney function will be a very important aspect of the accountability of the patients enrolled in this study, as well as the adherence to recommended changes in hemodialysis prescription. And the ultimate goal of the research team is to offer a new choice of dialysis care pathway that is in the form of bespoke hemodialysis treatment plan that complements patients' needs. I want to thank again the AAKP and the organizers of this meeting. It's been a great opportunity for me to present the TwoPlus study, and I look forward to a successful implementation and outcomes of this study. Thank you.
Thank you, Dr. Murea. We are all very thankful for the work you are doing and pleased to be a part of your efforts. As the research project progresses, we look forward to providing our patient membership with updates and disseminating the results. I'd now like to welcome our final speaker. Understanding that receiving a kidney failure diagnosis can be disheartening, Precious McCowan had graduated college, started a new career, and began a family when she was diagnosed with end-stage kidney disease. 2 kidney transplants later, and now an in-center hemodialysis patient, she's here today as an AAKP ambassador to share how she stays motivated and hopeful about how innovation in the dialysis space will allow her to continue to live her best life. Precious, I turn the presentation over to you.
Thank you, Melissa, and thank you, AAKP, for having me. My name is Precious McCowan, and I am a national kidney disease patient advocate, educator, mentor, and donor mom. My advocacy journey began in 2015, refusing to let any of my peers struggle on dialysis as I did. Today, I would like to share with you my experience as a dialysis patient and kidney pancreas transplant recipient and why research and new developments are so important to improve the quality of life for individuals with end-stage kidney disease like myself. At the age of 9, I was diagnosed with type 1 diabetes. During that time, my healthcare team always reminded me about the risk of going blind and amputations as a diabetic. However, I was never told about the risk of having kidney disease. In 2009, I was diagnosed with stage 3B kidney disease that quickly progressed into end-stage renal disease and needing to start emergency dialysis. I did in-center hemodialysis for 4 months before receiving my first kidney and pancreas transplant in 2010. Unfortunately, both organs only survived for 7 months. So I returned to in-center hemodialysis because it was the modality that I felt comfortable with. And to be honest, it was the only modality that was introduced to me. When I lost my kidney and pancreas transplant, I was depressed and not engaged with my health care. I struggled on dialysis until one day I decided that I would not let kidney disease defeat me. After a few years of returning to in-center hemodialysis, I began to hear more about home dialysis and its benefits. Still, at the time, I was comfortable in center and was looking forward to receiving my second kidney transplant. Looking back on my experience and the time I spent going back and forth, driving to dialysis facilities, and spending so much time in center in a chair, I wish I had received more education and resources early on about home therapies. This would have allowed me more freedom and better health outcomes. After waiting on the kidney transplant list for 8 years, in 2019, I received my second kidney transplant. I had so much energy, I was full of life, and had accomplished much more with my dissertation than I did on dialysis. As a kidney recipient and donor mom, I appreciate my donors donating life so that I can have a second chance at better health. Unfortunately, biological aspects that were out of my control caused me to reject my second kidney transplant. In January of 2023, I returned to in-center hemodialysis for a third time. This time I was better prepared and more educated about the pros and cons of kidney therapies. And I was convinced that I would be a great candidate for home hemodialysis. However, I experienced limitations with my access and vision impairments that deterred me from being successful with this type of modality. So I returned to in-center hemodialysis. I must admit that I was upset that there was no support or resources for me to assist with me wanting to do home dialysis and stay home. However, knowing that there are companies like Outset Medical that are conducting research and advancing treatments of dialysis gives hope to me and my peers, allowing us to have better experiences living on dialysis. Also, listening to Dr. Murea's research on conventional dialysis and insurmountable dialysis is inspiring and a very patient-centered approach to dialysis treatments. It's time to improve the way dialysis treatments are administered. 3 times a week for 4 or more hours. So many of my peers, including me, experienced the horrible symptoms of dialysis, such as fatigue, itchy, dizziness, nausea, brain fog, and much more. It's time for change. We are depending on scientists, researchers, engineers, and clinicians to develop devices and medications that improve our health and the way we manage kidney disease. The global dialysis population is growing and research is helping. But what good is research if patients are not at the center of the work and included from the beginning to the end of development? Remember, we do it better when we do it together. Thanks again, Melissa and AAKP, for having me.
Precious, thank you for sharing your journey with kidney disease. You are an inspiration to many who are living with this chronic condition.